COVID-19 di Malaysia sejak akhir-akhir ini. Sidang Kerajaan pada 1 hari bulan Mei telah memutuskan untuk menggunakan sistem amaran awal yang lebih bersepadu bagi mengenal pasti kawasan atau premis yang berisiko atau berpotensi menjadi hotspot atau pusat penyebaran virus COVID-19. Sistem amaran yang dikenali sebagai Hotspots Identification for Dynamic Engagement atau HIDE ini menggunakan analisis data raya ataupun big data dan kecerdasan buatan artificial intelligence menerusi pengesanan kontak dan membuat ramalan kemungkinan terjadinya sesuatu kluster. Jadi ini adalah pre-emptive predictive system. Analisis HIDE akan memberikan maklumat penting bagi membolehkan pihak berkuasa, termasuklah Kementerian Kesihatan dan kementerian-kementerian lain, untuk mengambil tindakan awalan ataupun pre-emptive secara bersasar untuk mengelakkan terjadinya sesuatu kluster daripada lokasi atau hotspots tersebut. Kerajaan telah bersetuju untuk menyiarkan premis-premis yang tersenarai di bawah HIDE bermula pada 7 Mei bagi membolehkan pemilik premis dan orang ramai mengambil tindakan wajar bagi mencegah terjadinya kluster berpunca daripada premis tersebut. Antara tindakan yang perlu dilaksanakan oleh pemilik premis ini termasuklah melakukan ujian saringan secara massal terhadap pekerja-pekerja di premis tersebut, menjalankan kawalan orang ramai yang lebih ketat, menjalankan gatekeeping yang lebih ketat, iaitu kemasukan dengan menggunakan aplikasi QR Code MySejahtera dan menghalang mereka yang berisiko tinggi dalam MySejahtera untuk memasuki premis tersebut. Selain itu, penyiaran senarai premis ini juga membolehkan orang ramai melaksanakan pengawasan kendiri, termasuklah dengan tidak berkunjung ke sesuatu premis atau kawasan berisiko pada waktu premis tersebut disenaraikan sebagai potential hotspot dalam sistem HIDE. Intervensi awal termasuklah menerusi pematuhan kepada notis yang dikeluarkan HIDE akan mengelakkan kerajaan mengambil tindakan drastik seperti pelaksanaan PKP yang lebih ketat. Ini adalah langkah kerajaan untuk memastikan bahawa intervensi kita mempunyai satu pendekatan yang lebih bersasar, targeted intervention that is preemptive. Pada 3 Mei, HIDE telah mengenal pasti 1,660 hotspots di seluruh negara yang berpotensi menjadi kluster, iaitu peningkatan daripada 1,170 pada minggu lepas. Selain itu, menerusi data terkumpul, sejumlah 90% penyebaran COVID-19 berlaku di 0.2% premis yang berdaftar menerusi MySejahtera. Ini adalah satu maklumat yang penting bagi kita melaksanakan intervensi yang bersasar. Kalau sekiranya kita melihat kepada data yang saya sebutkan tadi, 90% daripada penyebaran COVID-19 berlaku di 0.2% daripada premis sahaja. Jadi kalau sekiranya kita mengambil tindakan intervensi bersasar, kita hanya memberi intervensi kepada premis-premis tersebut dan tidak mengadakan satu kawalan pergerakan secara besar-besaran. Bagi membolehkan analisis HIDE yang lebih tepat, premis perniagaan yang masih belum berdaftar menerusi MySejahtera hendaklah berbuat sedemikian pada kadar segera selaras dengan arahan yang telah dikeluarkan sebelum ini yang mewajibkan imbasan kod QR bagi setiap pengunjung di premis. Kerajaan juga menggalakkan kawasan-kawasan perumahan, residential areas, dan juga bilik-bilik mesyuarat di dalam bangunan mempunyai imbasan kod QR sendiri untuk kita pastikan dalam satu bangunan itu di manakah mereka yang telah dikesan bergerak, dan ini membolehkan satu intervensi yang lebih bersasar daripada hanya melihat kepada imbasan kod untuk bangunan yang besar sahaja. Kerajaan juga menghendaki supaya dormitory pekerja juga diletakkan imbasan kod QR untuk digunakan bagi analisis HIDE di dormitory tersebut. Walaupun HIDE merupakan sesuatu langkah ke hadapan dalam menghadapi pandemik COVID-19, setiap ahli masyarakat serta perniagaan masih tetap perlu mengamalkan norma baru dan mematuhi SOP yang merupakan langkah terbaik dalam penularan COVID-19. The Hotspots Identification for Dynamic Engagement System has been developed by the government as a pre-emptive targeted intervention tool. By using this system, we will be able to identify potential hotspots ahead of time. These hotspots, large potential hotspots that are identified under HIDE, will be publicized so that broad-based interventions can take place by the premise owners. Among the broad-based interventions that will be implemented at potential hotspots that have been flagged by HIDE will be to test workers in the affected premises. Secondly, to increase gatekeeping measures, which means to inspect the MySejahtera risk status at check-in and to refuse entry to high-risk individuals as well as HSO breakers and perhaps also for close contact individuals. Third is to tighten crowd control, lower number of occupants at all times, and on-premise surveillance omnipresence by PDRM, RELA, or ATM. Fourth, to mandate management of affected premise to self-regulate. If an office premise has been flagged as a potential large hotspot, then the premise owner or the office owners will be mandated to instruct their employees to work from home. Fifth, to advise symptomatic individuals who have visited the hotspots to get tested via MySejahtera push notification. And of course, that we will publish the daily list of large hotspots on MySejahtera to ensure that we empower the businesses, the premise owners, to ensure that they will institute broad-based interventions that I mentioned earlier, and also as a tool for the public in wanting to visit these premises to exercise caution at all times. Sector-specific intervention subject to risk assessment, for example, include the following. If a particular shopping center has been flagged under HIDE as a potential high-risk hotspot, gatekeeping will be enforced at all entrances. Occupancy limits may be tightened, especially in tight spaces, and workers will be tested. For offices, sector-specific interventions can include switching to remote work arrangements, especially for large hotspots, reducing in-person presence for managerial and supervisory roles, and again to test high-contact workers at intervals. Third, for restaurants, which are identified as high-risk or high-risk hotspots, stricter indoor and table occupancy limits, perhaps even restricting dining options, and testing high-contact workers at intervals. Untuk analisa tersebut, dia bergantung kepada beberapa variable, dan antara variable yang kita melihat adalah dari segi kes-kes positif yang telah hadir di kawasan tersebut, exposure time, jumlah masa yang mereka ada di hotspot yang ataupun potential hotspot yang dikenal pasti dalam HIDE, dan juga keluasan dan ventilation yang ada dalam bangunan tersebut. Maka dengan variable-variable tersebut, satu analisa dibuat untuk meletakkan premis tersebut dikategorikan sebagai potential hotspot di bawah sistem HIDE. Kerajaan harap bahawa dengan pelaksanaan HIDE ini, ia akan memberi satu ketelusan yang lebih jelas kepada rakyat berkenaan dengan kawasan-kawasan ataupun premis yang boleh menjadi hotspot. Dan saya ingin tegaskan di sini perbezaan antara kluster yang diumumkan oleh KKM dengan hotspot di bawah HIDE. Kluster mengambil sejarah jangkitan yang telah pun berlaku di kawasan tersebut. Tetapi hotspot di bawah HIDE adalah satu langkah pre-emptive, jangkaan bahawa premis tersebut kalau sekiranya tidak ada intervensi seperti mana yang saya telah umumkan nanti, bakal menjadi satu kluster yang besar. Dan sistem HIDE ini telah membolehkan kerajaan melalui teknologi yang canggih untuk membuat ramalan tersebut dan untuk kita membuat satu intervensi awal ataupun tindakan awal secara bersasar untuk mengelakkan terjadinya satu kluster yang besar daripada lokasi ataupun hotspot yang dikenal pasti oleh HIDE. Okay, any questions? Kita akan paparkan list tersebut dalam MySejahtera. Maaf, kita akan umumkan list tersebut. Ya, kita akan umumkan list tersebut. Belum lagi ada keputusan untuk integrate dengan MySejahtera. Kita akan umumkan list tersebut. Senarai tersebut.
Melalui kaedah macam mana wajib?
The list will be announced. Yeah.
Through the CITF website ke macam mana?
No, this will be done by KKM, CPRC. Senarai itu adalah senarai yang akan diumumkan oleh CPRC. CPRC akan mengendalikan sistem HIDE ini. Kenapa saya umumkan pada hari ini? Sebab saya Menteri Teknologi dapat umumkan teknologi ini. Okey. Ada soalan lain? Teknologi ini developed by government. Sulit? Ya, code blue, sulit.
Hi, Wendy. I just have a couple of questions. So the first one, you said that 90% of COVID transmission happens in the 0.2% of premises registered through MySejahtera. So what are these can you list down these 0.2% of premises? That's my first question. And my second question is, it doesn't seem like HIDE is any much different from what is already being done. I mean, when there are COVID cases detected in premises, the usual step is to inform the premise owner, they get tested, place is sanitized, etc. Contact tracing is done. So how is HIDE really that different? I mean, you say that HIDE has, on 3rd May, HIDE identified 1,660 hotspots nationwide. So how do you know that the technology works? How many of these hotspots did eventually lead to clusters? That's my second one. My third one, I think, contact tracing. Is the problem really with MySejahtera failing to track COVID cases? Because we're still relying on MySejahtera check-ins for this HIDE system, but previously the Health Ministry said that MySejahtera only tracked 4% of COVID cases, and as far as I understand, contact tracing is still a huge problem, which is the reason why COVID has spread so rapidly. That's nice.
Yeah, that's why we are introducing, that's why that's why I've asked for more premises to start using MySejahtera, so that we minimize the number of blind spots to the HIDE system. The blind spots will occur if MySejahtera QR codes are not displayed. And that's why for certain places like residential areas, as well as for workers' dormitories, as well as for spaces within buildings. So for instance, meeting rooms, the requirement to check in again will enable the success of HIDE. Now, I want to say that the big difference between HIDE and what we practiced previously is that HIDE is predictive. It's not reactive. So in the past, the contact tracing will be done once patient X has been identified or tested as positive. Forward contact tracing will take place. With HIDE, HIDE does both forward as well as backward contact tracing. By comparing the places in which multiple people who have tested positive in backward contact tracing, the HIDE system is able to predict whether or not that particular hotspot that has been identified will be responsible for more transmissions in the future. So in the past, when we have a large number of people that have been positive in a certain premise, only then do we intervene. But what HIDE does is it tries to predict. It tries to predict whether a certain premise will show up over the next 7 days, multiple transmissions, and take action as soon as it is flagged as a potential hotspot. For MySejahtera itself, we have had 47% successes in tracing close contacts, and 7% through the self-assessment in identifying positive cases. That was previously. Now with HIDE, we believe that this will go up further because of the ability of the HIDE system to do both forward and backward contact tracing, and to predict based on that information whether that particular premise will be responsible for an exponential rise in transmission over the next few days. Is that okay, Susulan? Okay.
Sorry, just to clarify, will this MySejahtera data be available to the different district health officers? Because from my understanding, the current a lot of PKDs don't seem to have direct access to the data from MySejahtera check-in, so a lot of them rely on manual contact tracing, which can take days, I've heard, even to trace just one.
That is inaccurate, Susulan. All the data is shared with the districts. Yeah? Okay. Thank you. Yeah?
Hello, Wadi.
Hello.
I'm Lisa from my question is, since Wadis are encouraging the condos and premises to register under this, to register QR code, and then so that it can be placed under HIDE system, is it will be resulting in some kind of PEMCO or EMCO if a cluster or if the case is predicted at the premises?
As I said earlier, HIDE will enable the government as well as the premise owners to make interventions that I just outlined. Testing, making sure better gatekeeping, making sure better SOPs, making sure less crowds at that particular place. But as far as decisions on movement control is concerned, that is a decision that is to be made by MKN. This is, HIDE is a system which allows for certain premises to be identified early and for intervention to take place. Ya, soal MCO dan sebagainya itu adalah keputusan MKN dan akan diumumkan sekiranya ada apa-apa oleh Yang Berhormat Menteri Kanan. Ya, but today I'm explaining about the HIDE system.
Bagi follow-up question is, what if the hotspot in the HIDE system is a residential premise? Will it be increased preventive measures and like the street others, for example?
Sorry?
What if the hotspot in the HIDE system is a residential premises, apartment, condo, especially those with lots of foreign workers? What are the preventive measures will be in place?
Well, the first thing that I want to say is that residential areas are still a blind spot. Yeah, so we really need residential areas, including condominiums, high-rise, especially dense residential areas, to put the QR code, the MySejahtera QR code there. As far as intervention for residential areas are concerned, among the intervention will be testing, will be ensuring that people can self-check and self-monitor their health status.
Thank you, Wati.
Ready?
Yeah.
Right, Joseph from the start here.
Yep.
When you said that there were 1,660 hotspots identified, can we have a bit of a clearer picture on what mostly these hotspots are? Are they, what buildings are they, and what places actually the government intends to look into most? Which one is most serious? They need to be looked into.
I don't want to preempt the announcement on Friday, which is when we will list down the numbers, the large hotspots in Malaysia. But I can tell you that, for instance, at the moment, some of the large hotspots in Selangor and KL range from shopping malls, food and beverage outlets, supermarkets, bazaars, spots, large potential hotspots that have been identified by HIDE. I also want to add that people who have been to these hotspots will be categorized as close contact, casual contact, sorry. People who have visited these potential hotspots will be categorized as casual contact. And for people who are flagged as casual contact, kita sarankan kawalan kediri. That means to self-monitor for symptoms. In case there are symptoms, to get tested. So the system, HIDE system, will immediately alert if you have been casual contact, somebody who has been at these premises which we are preemptively predicting as potential clusters. Yeah? Then we will advise people to do self-health check.
Assalamualaikum, Bagi.
Yeah.
Bagi, boleh saya sebut sikit berkenaan dengan pembuluh-pembuluh ataupun variable yang digunakan dalam sistem HIDE ni. Bagi dia sebut beberapa, termasuk juga kes positif yang hadir di kawasan, jumlah masa mereka yang berada di kawasan berkenaan, kawasan serta aliran udara. Boleh bagi berikan satu contoh. Contohnya macam sebelum ni kita difahamkan ada 22 bazar di sekitar Kuala Lumpur dan Selangor yang ditutup. Di seluruh negara, maaf saya, yang ditutup disebabkan dipercayai menjadi potensi pusat penyebaran kluster. Boleh kita petik satu contoh tu dan apa antara perkara yang dah dikesan melalui HIDE sehingga membawa kepada arahan penutupan bazar.
Jadi untuk bazar, walaupun bazar dia adalah kawasan ruang luar, jadi boleh dikatakan sebagai well ventilated, tetapi sistem HIDE mengambil kira overcrowding ataupun keadaan yang sesak di mana orang ramai itu tidaklah terlalu transient. Maksudnya dia berada di kawasan itu pada jumlah masa yang agak lama, yang membolehkan sistem ini mengenal pasti kawasan bazar tersebut sebagai satu kawasan hotspot ataupun potential hotspot di bawah HIDE. Ya. Dan saya bagi contoh yang lain, kalau sekiranya ada banyak positive case dan kawasan itu sempit dan kawasan itu tidak well ventilated, maka ia akan menjadi satu potential hotspot yang besar. Tetapi kalau sekiranya kita dapati bahawa tak banyak kes positif yang pergi, kawasan itu bangunan yang luas, mungkin dia punya scoring dalam sistem HIDE itu adalah lebih rendah. Ya, jadi sistem HIDE ini mengambil kira pelbagai variable agar prediction yang dibuat itu adalah satu prediction yang bukan kata 100% tepat, tetapi satu ramalan yang boleh menunjukkan apa yang boleh berlaku sekiranya tidak ada intervensi.
Okay, maybe just a follow-up question for maybe dua soalan. Jika sesuatu kawasan itu di-flag by HIDE, adakah dia akan ditutup untuk sementara waktu untuk berbagi atau benda yang kurang? Contoh apa yang berlaku pada bazar ditutup pada 2 hari dan kemudian dibuka semula. Itu soalan pertama. Soalan kedua, betul kan saya kalau silap, tapi adakah HIDE ini dia mengesan sekiranya berlaku sudah kes positif di suatu kawasan baru intervensi dibuat, ataupun dia tidak mengambil kira, maksud saya tanpa perlukan seseorang itu didapati positif di satu kawasan, HIDE boleh buat rujukan ataupun ramalan awal untuk berlakunya pusat penyebaran, potensi pusat penyebaran.
Untuk soalan pertama, sama ada ia dapat melaksanakan, sama ada ia dapat intervensi itu adalah untuk menutup premis tersebut, ini bergantung kepada penilaian risiko. Jadi kita melalui Kementerian Kesihatan akan hantar pasukan untuk buat penilaian risiko di premis tersebut untuk melihat sejauh mana sistem amaran ini memberi satu amaran yang agak cemas berkenaan dengan premis tersebut. Sekiranya boleh terkawal ataupun boleh dikawal, maka intervensi untuk premis-premis tersebut adalah seperti mana yang saya sebutkan tadi, testing dan kawalan kemasukan dan sebagainya. Tak semestinya ia akan ditutup. Tetapi kalau sekiranya interagency team yang pergi melawat dan melaksanakan penilaian risiko itu dapati bahawa keadaan di premis tersebut adalah sudah luar daripada kawalan, maka option untuk menutup premis itu ada. Ya, kita tidak menunggu sehingga ada kes baru untuk membuat sesuatu. Kita tak tunggu sampai ada penambahan kes. Kita buat ramalan berdasarkan kepada bila dah ada kes, kita buat backward tracing, forward tracing, kita buat ramalan dan kita bertindak. Ya, sekarang seperti DG Health sebut bahawa keadaan sangat cemas. Jadi kita tidak menunggu sehingga ada kenaikan kes baru kita buat intervensi. Kita percaya pada sistem AI ini bahawa kemungkinan besar premis itu walaupun tidak ada banyak jangkitan tetapi bakal menjadi satu hotspot besar. Jadi kita ambil tindakan awal sebelum kita menunggu. Sekarang ni kita dah ada banyak varian, kita dah ada kes yang makin meningkat. Jadi kerajaan telah buat keputusan untuk menggunakan teknologi HIDE ini untuk membuat satu langkah intervensi awal. Next.
Hi, Wendy. Just a couple of follow-up questions. With this HIDE system, will my Sejahterra tell us if we are in close or casual contact? Because as it is, my Sejahterra doesn't even let us know if we are close contacts of positive cases. So that's one question. And in relation to that, if we are casual contacts in this HIDE thing, will the Ministry of Health give free testing first? Like, can people come up to any MOH facility, say they're casual contact, and then get free testing at MOH? And then my third question is, HIDE does seem to be a huge invasion of privacy. I mean, so we are not expected to scan QR codes even in our own homes. Like if we live in high-rise buildings, our high-rise buildings not expected to have QR codes and for residents to scan every time they go back home. That's it, thanks.
Right, so MySejahtera has notified casual contacts since March. So the statement saying that MySejahtera is not notifying casual contacts is not true. We have sent out more than 800,000 notifications for casual for contacts under MySejahtera. Yeah, and casual contacts only need to test if they are symptomatic. Just because you are identified and flagged as a casual contact doesn't mean that you need to go and test yourself immediately. You should practice self-health assessment, kawalan kendiri, and then only if you are symptomatic, then then you can go for your test. Yeah, that will allow you to evaluate your health situation. As far as invasion of privacy is concerned, we are asking you to scan the QR code when you visit residential areas. You know, when you go home, that's fine. You know, we're not asking you to scan when you go home to your own house, but we are asking you to scan if you go to residential areas or houses for social gatherings. Because kita dapati bahawa antara tempat penyebaran COVID adalah majlis-majlis sosial. Dan juga apabila kita pergi mengunjungi rakan-rakan ataupun sahabat handai kita, keluarga baru kita. So that's why it is essential for us to have this. This is why we have MySejahtera, to have contact tracing. Ya? Bukan sebagai satu usaha untuk invade people's privacy, tetapi untuk membolehkan kita melaksanakan contact tracing. Jadi HIDE ini adalah penambahbaikan kepada sistem pengesanan kontak yang sudah pun sedia ada di bawah MySejahtera. I just want to remind everyone that our critical care capacity at the hospitals are nearing its limits. And that's why we have to enhance the contact tracing without sacrificing the economy as well. We don't want to have a full-blown shutdown. So we have come up with this targeted intervention which is predictive based on technology, which I am announcing today, called HIDE. Next.
Yeah, hi Ravi, I'm Lisan from GP Press again. Wonder if this HIDE, the hotspot announced in this HIDE system will cause some disruption to the businesses because people might afraid to go to certain business premises if the premises is on the list.
Thank you. We want to empower the community. Yeah, we want to be transparent and empower the community to make an informed decision. Cases are rising right now, and we want to ensure that there is a trade-off between people's lives and their health, as well as businesses to operate during this pandemic. So we feel that by being transparent, telling people the potential hotspots, large hotspots under HIDE, they can make a decision for themselves. It doesn't mean that that particular premise will be closed down. It just means that you have to exercise some caution when you go there. Businesses will have to intervene, as I've said earlier, and we will also make it known when a particular premise has fulfilled the necessary intervention criteria, and the HIDE system does not predict that that premise will be a potential hotspot, then it will be taken off the list. It will be taken off the list, and we will announce all the premises that have been removed from the list.
Hi YB, I'm Pamela from CNA. I have two questions. The first question is, you mentioned about the casual contact notification, which people have been receiving over MySejahtera. But currently, the notification does not give details of the location or date of the contact. So will HIDE be improving this in letting people know? And my second question is, Opposition Leader Anwar Ibrahim mentioned yesterday, and this has been mentioned repeatedly, that it's almost almost impossible to get data from the government. So will the government consider sharing all data with opposition in the name of transparency? Thank you.
Well, first of all, as far as the vaccination data is concerned, I've been very open with the opposition. Yesterday, I sat down with 3 members of parliament from DAP for over 1 hour, where they queried me on the budget, as well as the procurement, as well as the implementation of the National COVID-19 immunization program. Tomorrow, I'll be sitting down with members of parliament from Keadilan to do the same. I've tried to offer as much information as transparently as possible as far as the vaccination is concerned. This initiative under HIDE, by publicly listing potential large hotspots, is another step towards providing the public and empowering the community with greater information so that they can make informed decisions, as well as for premise owners to intervene far more quickly than if we had a reactive system in the past. This allows for community empowerment. It allows for business owners to quickly test, isolate their staff, to start working from home, to ensure that all protocols are put in place to ensure that their particular premise does not end up becoming a large hotspot. As far as the data is concerned, on if you are flagged as a casual contact, where and when, we are looking at this right now.
Maybe this is Ibrahim Sani from Astro Awani.
Yep.
Just a quick one on Mengenai Malaysia. What kind of data was shared or used in order to build this system?
This system was developed by CPRC Analytics under Ministry of Health, not Mengenai Malaysia. Okay. Thank you everyone. Terima kasih.